All right. Thanks for hanging with us here to the very end, all of you that are here. And what an amazing day of research, really. I mean, we heard about child health outcomes, violence prevention, substance use and suicide prevention, water and air quality, pediatric asthma, personalized medicine, and diabetes prevention, all in one day, not to mention the posters back there. So a really inspiring day of research presentations. And today, at the end here, we're going to talk about sleep a little bit. But before I get into that, I want to acknowledge my colleagues and collaborators. None of this would happen without Marshall O'Leary and Missouri Breaks and their amazing staff and research coordinators. We have Tracy Zacher, who I've worked with quite a bit on this, Danelle Buckles, Leslie Little, who's in the back, has been key, Karen Little Wounded, Megan Charbonneau, and Lindsay Ducheneau at Spirit Lake and Eagle View for those three. And then my collaborators at the Washington State University, Dr. Denise Dillard, Aaron Morgan, Clement Mueller, and Madison Ramos. All right, so what is sleep apnea? It is a disease where our airway collapses in on itself and we don't breathe very well in our sleep. Our oxygen levels drop. That's bad for our cardiovascular health. And it turns out when you don't breathe, your brain wakes you up. And so your sleep gets fragmented, it's unrestful, and you can have sleepiness during the day. Sleep apnea can affect attention, memory, and executive functioning, and it does increase risk of Alzheimer's disease, which is something that we're looking at as a part of this CatNap study. So what is CatNap? So we're looking at sleep apnea in two Native American communities, the Oglala Sioux and the Cheyenne River Sioux, also in Spirit Lake Sioux. The study is focused on how sleep health relates to brain health, such as Alzheimer's disease. And we've divided it into two elements. One is the observational study, which is looking at the epidemiology of sleep apnea in your communities. So how often does it happen? And then a randomized controlled trial, which is looking at using motivational interviewing to improve treatment adherence to PAP therapy. So let's see here. Yeah. So the observational study visit will look like this. It takes about 120 minutes. There's a physical exam. We do multiple surveys. We do a brain health screening. We get a saliva sample for those that want to participate in genotyping. And then we do this clever at-home sleep apnea test, which is shown here, which is just a little pulse oximeter type device that sits on your finger with a watch that can actually indicate whether or not you have sleep apnea. And so who's eligible? You can participate if you self-identify as American Indian, you're 40 years of age or older, you live on the Oglala Sioux Tribe or Cheyenne River Sioux Tribe reservations for 50% or more in the past year. You are a known tribal member, and you live in the household of a known tribal member and you've been there for at least 4+ nights during the past week. If you participate, there's a $75 remuneration, and if you can get additional compensation if you take part in the overnight sleep study portion. And so here's some preliminary results. First of all, you can see the ages of the people that are participating, and the most common age group is 60 to 69-year-olds. Everybody is age 50 or older. And we had anywhere from 7 to 17% of people self-reported having sleep apnea. And then we screened this called Stop Bang, which is 8 separate items. And if you score 3 or more, you're at moderate to high risk of sleep apnea. And what you can see is if you're a man that are over 50, you already have 2 points on this scale. And if you look at the total score, you can see a very high percent of individuals were screening above 3. And so, for the women, it was about 2/3, and for the men, it was 3/4 to 4/5 of individuals were screening in as being moderate to high risk for sleep apnea. And so those individuals were offered a watch pad, which is that home sleep apnea test I showed you. And you can see the percentages of people that did that at the bottom. And here's some of the results. You can see really the main result is this OSA diagnosis. So we split it into women and men in the Cheyenne River and Oglala Sioux tribes. And you can see that the prevalence of sleep apnea is quite high. Anywhere from 36 to 56% here. And that would be people that either self-reported having the disease or had it based on the watch pad. And you can see also just the high percentage of individuals that had a stop bang screener above or equal to 3, anywhere from 63% up to 93%. We did some sensitivity analysis to look at, people that did the watch pad that got an indeterminate result. It can't rule out sleep apnea. And then also people that, declined getting the test. We assume 30% of them have sleep apnea. You get even higher prevalence estimates here. So sleep apnea is very prevalent in your communities. That's the takeaway here. And not only that, but when we looked at a couple of other things, the Epworth Sleepiness Scale, which is a subjective measure of sleepiness, and a score of 10 or more is considered elevated. Most of the times people with sleep apnea will have scores 12, 13, even up to 15, okay? But your community seems to be very stoic, because even amongst, the men and women that have sleep apnea, the Epworth Sleepiness Scale is well within normal limits. So even though you're having this sleep problem, which we know often causes sleepiness and fatigue, you all are not expressing that as being a part of the problem for you. It's also true, insomnia is very common comorbidity with sleep apnea. It's present in about 40-50% of the time. Insomnia severity index scores that you all are showing are also within normal limits. So it doesn't appear you're not reporting a lot of sleep disturbance associated with your sleep apnea, as we would expect. And then if we just look at sleep durations, generally speaking, we would recommend adults sleep 7 or more hours on a regular basis to support optimal health. And so in some instances, you guys are close to that, but in others, sleeping a little less than that across the board. So if we look at, catnap in your communities, the prevalence of sleep apnea, 36 to 51% in women, 42 to 56% in men. And if you compare that to a lot of other research that's been done looking at this in, elder Swiss individuals, in the US population, in Australia, other than maybe in this older Swiss population with about 50% men, in general, the prevalence estimates that we're seeing in your communities are higher than that. So, we're not done with this yet. This is a preliminary analysis, but it's showing us that this is quite a prevalent problem in your community. And why would that be? There's a lot of reasons. Cardiometabolic risk is probably the biggest one. Obesity, we know that that's a big risk factor for sleep apnea. Every 1% increase in weight increases sleep apnea severity by 3%. So that's a big contributing factor. Diabetes and insulin resistance as well. There are craniofacial anatomic findings that could be specific to your community related to airway size, and then also the muscular tone in the throat. You know, we have to maintain muscle tone when we sleep to keep our airway open and keep our tongue from falling in our airway. And people with sleep apnea don't do that as well as people without it. You know, housing conditions, chronic stress, shift work schedules, those sorts of things. Diet quality can contribute to the risk. We know if you have refractory high blood pressure, treatment refractory high blood pressure, you got about an 80% chance of having sleep apnea. If you've had a stroke, you've got a 70 to 80% chance of having sleep apnea. Certainly alcohol use contributes to a collapsible airway, so that can be a problem as well. And then having large tonsils, childhood obesity too, can all contribute to that. And then insurance and referral barriers and limited sleep lab availability could contribute to these prevalence estimates differences. So let's pivot to the randomized controlled trial. So basically, people have sleep apnea. One of these PAP machines is excuse me. I should have gone forward there. All right. PAP machines are the treatment of choice. And so the randomized controlled trial is where people with sleep apnea, they get PAP machines. Half of these folks are randomized to get motivational interviewing to improve treatment adherence. So it's an approach that helps people resolve ambivalence around the treatment and move towards a healthy behavior change by drawing out their own specific motivations for participating in the treatment and moving forward with that. So here, you can participate in the RCT if you self-identify as American Indian or Alaska Native, if you're 40 or older, if you live on the Oglala Sioux Tribe or Cheyenne or Sioux Tribe reservations or surrounding Northern Plains communities. If you're diagnosed with sleep apnea, you have a prescription for a PAP machine, and you either just got it or you haven't been using it very much. And so there are 3 separate study visits that you would participate in with an opportunity for some remuneration as shown above here. We can also recruit you if you have some of the signs and symptoms of sleep apnea. Somebody tells you you're pausing in your breathing, you're snoring a lot, you sweat at night, you wake up with headaches, you might have mood changes or in daytime fatigue, sleepiness, trouble concentrating. If you have some of those symptoms and you identify as Native American, you're 40 years of age or older, let us know and we can do some testing with that home sleep apnea test to identify whether or not you have the problem and then help you get a treatment to be able to participate in the randomized controlled trial. And so if you have an interest in this, please contact these individuals. Karen Little Wounded in the Eagle Butte office of Missouri Breaks, Leslie Little in the Pine Ridge office, and Megan Charbonneau in the Spirit Lake office. Thank you very much for your attention.